Welcome back to the Contact Lens Institute's channel. I'm Dr. Stephanie Wu from the Contact Lens Institute of Nevada. Today we're going to be talking about what it's like to get LASIK and what you need to know. So LASIK eye surgery has been around for quite some time, and the doctors and the equipment manufacturers have really perfected this surgery. So it is a very, very effective way to correct your vision permanently or semi-permanently. LASIK is a laser eye type of surgery where they make a flap onto the front part of the eye, and then they use a special laser to ablate the tissue on the cornea, the front part of the eye, and then the flap is placed back. So I just want to talk about kind of what your experience would be like if you ended up getting LASIK surgery. So first, you would always visit your eye doctor to make sure that you're a good candidate. Your eye doctor is going to perform a multitude of exams to make sure that your eye is a good candidate for LASIK eye surgery. If your cornea is too thin, if your prescription is too high, if you have too much astigmatism, these are all things that could make it so that you're not a good candidate for the procedure. So that's always the first step, is just talking to your doctor, telling them that you're interested in LASIK, and then they can do a variety of tests to make sure you're a good candidate. If you are a good candidate, then they will send you to the surgeon's office, unless that's the doctor that you're already seeing, and they will also do a series of images to just confirm that you are in fact a good candidate. Once they determine that you are a good candidate, then they'll do a variety of things and measurements and putting things into the laser to make sure that everything's going to go perfectly and as flawlessly as possible during your actual surgery. So when you get to the eye center, you always have somebody to drive you. So you're not going to drive yourself. You're going to have somebody take you to the clinic, and they'll give you some anti-anxiety medicine if you need it. So something like Xanax or something else that will calm you down if it's something that you're really nervous about. So they give that to you, and you kind of hang out in the lobby. And then when it's your turn, then you will go back into the operating room and they'll get your eye prepped. So you basically just lay down. Most patients actually wear their own clothes. You don't have to change into anything special for the most part. So you're just wearing your own clothes. You lay down onto a little bed and they just basically prepare your eye. So what they'll do is they'll numb your eye with just eye drops, and then they'll use something called a speculum, which will get the eyelids open, because a lot of patients are worried that they're going to blink during the surgery and that's going to mess up their surgery. But don't worry, they use a special speculum that keeps the eyelids open so that you can't blink during the procedure. After they do that, then they'll use something, either a microkeratome or another type of laser that creates the flap. So most surgeons nowadays will use the laser, where they put some suction onto the eye and it creates these tiny little dots on the front surface of the eye. So imagine hundreds, thousands of little dots that go in between the tissue of the eye, and then that allows the surgeon to easily lift up the flap so that the next layer of the cornea is exposed. Now, during this time, if you are with a surgeon that has the suction, the vision's gonna go black. So don't worry about that. And I know the surgeons will always tell you about this, but sometimes my patients tell me that was the scariest part of the actual procedure, is when everything went really black. But that's normal. It's just because of the suction that's used, and it's just for a few seconds. So after the flap is open, now this is where the actual laser correction begins. So the doctor has already put in your exact prescription so that the laser knows exactly how much tissue and where to remove. So you've got the flap that's open, you've got the laser on the front surface of the cornea, and then all your job is to look at the red light. Again, don't worry about looking off to the side. It is not going to damage your eye. You're not going to mess up your prescription. Most machines now have something called iris tracking. So it can manage looking if you accidentally look to the side, or you accidentally looked up or down, or you have these little tiny micro eye movements. The machine will register for that, and the reaction time for the machine is much faster than you as a person. So don't worry about that. That is all accounted for with the special technology. So after the laser has ablated that tissue and changed the shape, which can range between 5 seconds to 1 minute, depending on your prescription. Then the surgeon will place the flap back on. So imagine it's kind of peeled up and then it's put back on. And then he or she will smooth out the surface of that flap to make sure that it is adhered to the cornea again. Now, after this, sometimes doctors will put a bandage contact lens on, or they'll leave everything alone and just put some artificial tears on. Either way, the eye is fully protected and the surgeon will definitely take a look before they send you home. Once you get home, you'll have to wear these special goggles anytime that you're sleeping or napping so that you don't accidentally poke your eye or rub your eye in the middle of the night. And you'll be put on some special eye drops to make sure that you don't develop an infection, and it also helps to control inflammation. So again, LASIK surgery is very, very safe. They've developed incredible technologies nowadays to help assist and perfect the technique. So if it's something you're interested in, definitely ask your eye doctor, and they will always be the best person to let you know if you are a good candidate. Thanks again for tuning in, and don't forget to subscribe to our YouTube channel to be the first to know about all of our different videos. Bye.